Joining us now is Dr. Kavita Patel, primary care physician in Washington, D.C., and fellow at the Brookings Institution, also an NBC News medical contributor. Dr. Patel, thank you for joining us. What should these companies be communicating to their employees about remote work and when it will be safe to come back?
Yeah, Sarah, I think this is a really important time period, January and possibly early February, as we look for hopefully we'll see a peak in Omicron cases in the United States over the next 4 to 6 weeks. But until then, I think that remote working where possible is safest, especially because I'm sure you know so many people who are getting this infection. And while if you're vaccinated, you're safe, what we're trying to prevent and why remote work can be important is that we still have a lot of unvaccinated people, a lot of children who are not vaccinated, and immunocompromised people with chronic conditions. So I think for those reasons, just as we're seeing possibly even, Sarah, 1 million plus cases a day when you take into account the self-report and people who are not self-reporting their home antigen tests, we're having too much of this in the community to go back to work 100%.
It's just staggering.
But hopefully in February it'll be different.
Numbers, a million a day. So what about those that cannot work remotely? And I'm thinking mainly about healthcare workers and shortages potentially here, which could really harm access to hospital beds. Already these hospitals are getting squeezed. How big of a problem is this? And does the new CDC guidance do anything really to help?
It does help. Look, in our area, the D.C. area, we've got anywhere from a 15 to 40% workforce shortage in healthcare settings because of people who are positive, largely asymptomatic because they're mostly vaccinated. But as you point out, the CDC guidance actually does help. So what we're hoping people do is we don't want people to come to work sick, period. But what we're hoping is that for those who are asymptomatic or mild symptoms, and especially some of us are encouraging healthcare workers to take a rapid antigen test on day 5 just to make sure they're not as infectious. Coming back to work can relieve me as a colleague who's kind of taking that slack right now because we have nobody to work. This is another reminder of why I think remote working is important, because things happen that are not COVID related, accidents, falls, injuries. We don't need any of those to come into an ER when we're holding things together by duct tape, Sarah.
Dr. Patel, looking forward optimistically towards February when hopefully we're past the peak of the Omicron variant, is it then less likely that there will be more variants because we would have had so many people that hopefully will have had herd immunity by that point?
Yeah, that's what we're hoping for. I do want to caution, though, we've said this almost every surge we had. Even when we had this Delta surge, we thought, well, OK, more infections means more immunity. And then, of course, we had Omicron that seems to be breaking through some of that immunity. So I am hopeful. Even more hopeful is that we see Omicron infections, ironically, protecting against the Delta strain. So I do think that that's signs that this could be the end of the first phase of the pandemic, which about 2 years in, I think we're all ready for.
Yeah, amen to that. What about hospitalizations? The fact that they are rising, how do you read that? And are we sequencing whether they're Delta infections or Omicron infections? And if not, why not?
Yeah, look, I just had this conversation last night with a colleague in a hospital, and I said, what do we know about our own hospital cases? And can't we look at that PCR and look for that S gene dropout? Truth of the matter is that there are only certain machines that can pick that up, Sarah, and we don't have an infinite supply. Not all hospitals even have them. So that we can't sequence everything, and we don't need to. What we do know is that we still are seeing some Delta, but more and more Omicron. And to be honest, in about 2 weeks, it'll probably be all Omicron, and there will be very little Delta based on the patterns. But to your point about hospitalizations, and I want to stress this, we are seeing a successful decoupling, meaning 1 million cases a day, but we're not seeing 3% of those hospitalized like we were with previous surges. And that's because of vaccines and to some degree, a smaller one, therapeutics. However, because of the sheer numbers, the actual absolute numbers, even with lower rates of hospitalization, are still so high that it's overwhelming the system. So on one hand, a success of vaccines. On the other hand, just a sheer failure because it's a virus and a strain that we couldn't have predicted.